Understanding facial aging is very important to being able to understand how facial rejuvenation should take place. If we think about our faces and their component parts, what we have to begin with is the foundation. Before you build a house, you always pour a slab for a foundation. It gives you something solid to build upon and support the structure that you place upon it. The face is exactly the same way. The cranial skeleton, the bones of your face, are that foundation of the way your face looks. Unfortunately, as we age, we lose bone mass. That means that our cranial skeleton gets smaller as we age. I often make the analogy that if you look at a mandible, the lower jaw, of someone who's 18 years old, it's about 1.5 inches high. If you look at that same mandible on an x-ray at someone who is 45 or 50 years old, it's only about 1 inch high. And if you look at that same mandible at someone who's 70 years old, it's only about 1/3 of 1 inch high. So you can imagine you've lost over 1 inch of foundation of your cranial skeleton during your lifetime. Now, what effect does that have on the way we look? Well, our facial mask, the skin and muscles and nerves and blood vessels, as well as the fat of your facial mask, is supported by the underlying foundation of your cranial skeleton. As that foundation recedes, your mask tends to sag down. The second thing which happens during the aging process is the mask itself begins to thin. We all know that when we look at babies' faces, they're fat with chubby cheeks, there's a lot of volume there. But when we look at people who are in their 70s and 80s, what we see is gaunt, thinner facial masks and loss of volume. And so many studies have been done which show that the loss of volume in the face is 80% the contribution of the aging process. So 80% of the way you look is because of loss of volume. And it's loss of volume from both the foundation, the cranial skeleton, and thinning of the facial mask. Now, you can imagine that if you don't have as much support and the mask itself is thinning, then it's just going to sag down your face. We used to think that skin stretched and that aging was all about skin stretching and skin was hanging and all of that. And what we know now is that 80% of that is really just volume loss. The rest is some laxity of the skin. So the rejuvenating process of a facelift alone with just tightening the skin will only correct 20% of the aging process that people go through throughout their lifetime. The addition of volume to a face without a surgical procedure will automatically add youthful look to a face. So today, a modern facelift incorporates not only lifting techniques, but also volumizing techniques. The most common procedure that I do when I'm doing the facelift surgery is fat grafting. Fat grafting takes your own natural fat, processes it, and then adds it back to the facial mask in places where you have lost volume and gives you a beautiful, youthful, fuller facial mask, which makes you look much younger and more youthful after the procedure. In younger patients who come in and always tell me, Doc, I just want this. I don't want this, I just want this. We have traditionally had one method of treatment for that, and that was a surgical procedure. Today, we have a revolutionary new procedure that is called Ultherapy, which actually tightens the underlying structure of the face, the same structures that we use during a facelift procedure to tighten and lift the face. But Ultherapy does this in a non-invasive way with ultrasound energy, which passes through the skin without injuring it and is focused on the underlying layers of tissues which we use to tighten the face during a facelift. This procedure has virtually no downtime except for the hour in which you are in our Mirror Beauty Boutique having the procedure done. You can have lunch before, you can have lunch after the procedure. You can come during your lunch hour and have the procedure and go back to work. This technology tightens the underlying fascial structures and muscles in the face so that gradually, over about a 3-month period of time, the collagen fibers in those tissues is regenerated, and those collagen fibers lift the face, the jowls, and the neck, much like a facelift would do. Now, Ultherapy is not a replacement for a facelift in a patient who's 60 or 70 years old. But in a patient who's 35 or 40 or 45, who just has a little bit of jowling or a little bit of extra skin in the submental area, Ultherapy is the perfect technology that really works, that will give you that improvement that you're looking for without downtime and disruption to your everyday life schedule.